The private health sector provides about 50% of all care to patients in Kenya, yet more people are still turning to the private because the public sector is often overburdened. However, the private sector lacks access to capital due to poor business qualifications and the high cost of startup. In addition, there is no structured way to measure and improve healthcare quality. The Medical Credit Fund is bridging this gap by availing affordable financing to the sector to enable health facilities invest in quality improvement and increase capacity of service delivery. Gynocare Fistula Center and Nursing Home in Eldoret Town is one such facility. They are soon moving out of a high-cost rental building to their own health complex with expanded services.
With the increment in rent, quickly they thought of coming up with a new facility that is owned by Gynocare where we don't pay rent, where we do expansion. And, we started looking around and seeing which way can we best fund or come up with this facility. Medical Credit Fund came. We pursued this through KMET, and actually we were able to get a loan of around 40 million, which helped us actually to start the facility. Once we get to the other facility, there will be so many opportunities, because when we look at what we have now, the private patients, we have maybe 3 rooms actually, and those 3 rooms are not able to accommodate so many patients. And when we go to the other side, we have around 26 private rooms, and that will accommodate a bigger number of patients. We have 1 operating room, which is actually of a ward. Sometimes we have patients, when we have even emergencies coming in, we are not able to operate because once a doctor is there, we don't have space. But when we go to the other side, we have 2 operating theaters. And then initially we've had issues with the complications, post-operative care, and the patient needs ICU services, which we don't have. We source from other hospitals. And sometimes other hospitals don't understand that these are patients who cannot even pay for their accommodation. So once they go there, it becomes very expensive for us to pay for their ICU services. But the good news is that this new facility has the ICU unit.
Sami Said, a co-director of God's Will Medical Center situated in the expansive Kisumu's Nyalenda informal settlement, tells of his journey to success and how he has moved from attending to 5 clients to seeing over 30 clients in a day.
We started God's Will Center way back in the year 2001 as a very small facility run by me, Sami Saidi, Janet Ogutu, who are the co-directors, and 2 other staffs. So in total we were only 4 by then. We started by only operating in 2 rooms. Now we have almost the whole building, and we have now different departments. We have maternity, we have laboratory, we have a recovery area, and we have the outpatient. So with the MCF loan, now we acquire this place. And this place occupies the MCF, 2 recovery rooms, and child welfare clinic. So as here we are standing at the waiting bay, where all mothers of those clients coming from MCH, FP, they have to sit here before they are sorted out. Used to get about 5 clients in a day, but now the clientele has increased. We could see now between 20 to 30 clients daily. That makes an average of over 400 to 500 clients every month.
The Medical Credit Fund, in partnership with KMET, also provides technical assistance on quality improvement according to international standards of quality known as Safe Care. Recently, Cherangani Nursing Home in Trans Nzoia County was declared a Center of Excellence in Quality Healthcare after attaining Safe Care Level 3.
We met our friends, KMET. I think it was the year 2011. When they invited us for a meeting in Kisumu. We were first assessed, I think we scored very low, 43%. And then after training, we jumped up to 74%. And after about two years, when we were assessed, we were graded, or we were given certification of level 3. And that's about 2 years ago.
It helped us to improve our record management system. Previously, we used a manual record system. So it was very difficult for us to be able to retrieve patient files. So, but right now, with the training that our staffs have, it can't take you more than 10 minutes to retrieve a file. And also we have electronic backup data. So once you visited this facility, maybe on January, when you open we click your name, we can be able to see your history electronically. In terms of bills, we are able to do bills. We can be able to give estimates because this data is keen on daily basis. So the entry is done in ward in the pharmacy. So everything that is done to a patient, it is captured.
We had a negative attitude towards quality health because we thought it was bothering them, it was bothering us, we were spending a lot of money on them. In the beginning, tell you we were mistaken. The time that we changed our mind to be able to do quality health, we realized that we were actually saving a lot more on what we thought we were spending. One, we were able to critically look at our needs and therefore stick to some of the things that we did not want to waste. We were able to keep things clean, and therefore we reduced even the cost of cleanliness, repairs, and many things.
They too have benefited from affordable and flexible loans, channeling the amount to equipping the facility for more services.
They gave us some money which I was able to buy a CT scan for the hospital, and gradually they gave us even more, which we were able to buy operating tables, and started our new theater and several equipments that we needed. We were able to purchase them. So we improved our standard of healthcare in this hospital.
We get many referrals from other facilities to come to do those CT scans, those examinations. And you know, when they come to do those examinations, they pay money. And by this, it has improved our income very tremendous. Previously, you used to have around 10, 20 operations in a day, in a month. But currently, we are talking about 80 to 100 operations in a month.
Palmer Hospital, an equally ambitious but smaller health facility in Siaya, boasts of their achievements in their work with safe care. They have stronger administration systems, more responsive feedback mechanism, improved laboratory services, and are expanding the hospital space.
As far as safe care is concerned, the general outlook of the hospital has really improved compared to how it was before you guys came in. It has really improved, starting with maybe the cleanliness of the hospital before you guys came in, and right now I would say we have made a huge step ahead. In terms of our waiting time, no patient is staying here for more than 20 minutes without being seen by a doctor. So waiting time has really improved, and that one we are getting it from feedbacks from the patients. So waiting time has improved, and patient-staff relationship, starting from the reception and the ward, and even patient-doctor relationship, from the feedback you are getting, initially we used to have a lot of complaints about the attitude of staff and all that. But currently, I would say on that particular aspect, we have made a huge stride. We have really improved. Initially, we know we used to have issues to do with contracts and job descriptions. But when you guys came in, Self-Care came in, actually, I would say currently, all the staffs have files with job descriptions and contracts actually.
We had clinicians and technologies board team who actually came there. We initiated the registration of this facility, the laboratory. It's an independent facility. And they were so much surprised that we go so high. And we told them point blank that all that they see is courtesy of what the KMET team has been doing all along. Because they are so much surprised to find at least, in fact, everything that they need is there. They even have more than what they need, so they have to borrow from banks.
Over the coming years, MCF, in collaboration with KMET, aims at making quality count in both the public and private health sectors for the common good of all patients.